Did you know that the United States is one of 3 first world developed countries that does not have a universal healthcare system? I personally find this just a little bit embarrassing that people can say that we are the richest country or one of the richest countries in the entire world, and yet we don't even care enough about our people to give them a healthcare system that gives back to them. If we go back to the founding of our country and look at the Declaration of Independence, we can find that there are 3 unalienable rights for every man or woman, these rights being the right to life, liberty, and the pursuit of happiness. The right to health care falls under the right of life and the pursuit of happiness and can be internationally agreed upon that healthcare is a basic human right. If we look at a peer-reviewed study in the LandCat, the right to health is not just good management, justice, or humanitarianism, they are obligations under the human rights laws. In the next few minutes, I will attempt to persuade you that the United States should have developed and implemented a universal healthcare a long time ago, and if not a long time ago, they should at least do it right now. A study from the University of Massachusetts, Amherst, said that under a single-payer tax system where all citizens are guaranteed a right to healthcare, total public and private spending could be lowered by up to $1.8 trillion over the next 10 years because of lower administrative and prescription drug costs. And I know what you're thinking. The first thing everybody thinks of when they think universal healthcare is the costs and how much taxes would go up and those type of things. And yes, it is true that because we are taxpayers, our taxes will go up because that's how the government gets their money. And according to an American Health Journal study, European countries with universal healthcare, for example, the United Kingdom, their payroll taxes are 37%, which is much higher compared to the 15.3% on average that the US pays every single year. However, if you look at the study the Institute of Medicine came out with a couple of years ago, Canada and the UK spend 47 and 42% of what the United States did per capita, so the average per person, in 2017, with South Korea being at just 28%. So what this means is that, is that every single year you would actually be paying less for healthcare because the system right now is actually you're paying more than you would when the taxes get raised. In addition to it actually being cheaper every single year, there are thousands of people dying right now underneath this healthcare system. And I know you're thinking, okay, maybe not thousands, maybe just hundreds, but no, it is thousands. According to a study from Harvard researchers, a lack of health insurance is associated with about 44,789 deaths per year, which translates to a 40% increase of death among the uninsured. That's 44,789 people who are robbed every single year of their right to life, liberty, and the pursuit of happiness. Those are just the people who died because of not having health insurance. Right now in America, there is 25.5 million people who are uninsured. That's 25.5 million people who live in fear every single day of getting the cold, catching a flu, breaking a bone, spraining an ankle, something that I can walk into a clinic and just get rushed to the back to be able to get fixed. They do not have that option. And I know what you're thinking. So, okay, what if we don't just get rushed to the back, and these other countries can take a really long time if they're having to see so many people? And that is true. So according to the Government Accountability Office, countries with the universal health right have longer wait times than the US, with an average wait time in Canada to see a specialist being 60 days compared to the 24 days it takes in the United States. That is something that my opponent could use against me, which is a fair point. However, a Commonwealth study found that due to a lack of timely and effective healthcare in the United States, they ranked at the very bottom of the 16 richest nations in the world in terms of preventable mortality. A further study published by the LandCat ranked the US 29th out of 195 countries and territories in terms of preventable mortality. And it wouldn't take you 60 days to see if you have a broken bone or if you have a cold or if you need to be seen right away by a doctor. They're not going to make you wait 60 days. That is specifically to see a specialist if you have a brain scan you need to get done that's not life-threatening, or if you want to get plastic surgery on your nose or something like that. That's something you would have to wait 60 days for. I would much rather it take 60 days to see a specialist than have to wait in the emergency room for hours or even days before getting seen by a nurse or being seen to put IVs in me so that way I don't die from dehydration. I would much rather be minorly inconvenienced by not being able to see the specific specialist I want rather than dying in the emergency room in the United States. In addition to not dying because of preventable mortality and preventable causes, and it actually being cheaper, it would also help the United States economy. According to an Institute of Medicine report, the U.S. economy loses between $65 and $130 billion annually as a result of diminished worker productivity due to poor health and premature deaths among the uninsured. So if people really cared about wanting the economy to get better, which many people are saying right now due to elections and just personal beliefs, they think that the economy is not where it should be and should be getting better. If they really wanted their coworkers to stop calling out because they're sick and because they can't make it to work, they would want a universal healthcare system that would allow these people to go in and get help and be able to come back to work sooner. And I know I haven't actually said anything about the implementation costs, and my opponent might bring up that the Committee for a Responsible Federal Budget calculates that the universal healthcare coverage would result in a $19 trillion federal debt because of implementation costs. What this study fails to tell you is that that cost, the $19 trillion, does not take into account the fact that the taxes would actually be higher. Remember, the taxes being higher is a good thing. We want that because we, the taxpayers of America, would actually be paying less under this system. So while we don't actually have a real number of what it would take to implement a universal healthcare system, we know it would not be $19 trillion if taxes got raised to what they are in Canada or in the United Kingdom. And I will just leave you with one final question. If I haven't been able to convince you by now, I want you to think about the fact that do you care more about an economy or the United States government that doesn't even know you exist, or about the community, about your neighbors, about your family members, and about everybody else who lives in fear every single day under the current system? Thank you.